Every 2 minutes, somewhere in the world, a baby is born through a cesarean section. But not all C-sections are the same. Some leave women with longer pain, visible scars, and slower recovery, while others ensure faster healing, less trauma, and a safer start for both mother and child. So, what truly is the best cesarean section technique? A cesarean section, commonly called a C-section, is one of the most frequently performed surgical procedures in modern obstetrics. It is usually performed when a vaginal delivery poses risks to the mother or baby, or in certain emergency situations where rapid delivery is necessary. Over the decades, several surgical methods have been developed and refined, but the overall goal has remained the same: ensuring the safety of both mother and child while minimizing complications and promoting faster recovery. Traditionally, techniques involved larger incisions and more invasive approaches. However, with advancements in medical science, less traumatic methods have emerged, leading to reduced pain, shorter hospital stays, and better long-term outcomes. Among these, the Pfannenstiel incision, combined with the Misgav Ladach technique, has gained global acceptance as the best cesarean section technique. It balances efficiency, safety, and cosmetic results, making it a preferred choice for obstetricians worldwide. The Pfannenstiel incision, also known as the bikini cut, is a horizontal incision made just above the pubic hairline. This method has become the standard because it provides excellent access to the uterus while minimizing visible scarring. Compared to vertical incisions, the Pfannenstiel approach is less painful postoperatively and offers better cosmetic results. Additionally, this technique reduces the likelihood of wound complications, such as hernias or infections. Since the muscles are separated rather than cut, the healing process is faster, allowing women to regain mobility within a shorter period. The incision is also strategically placed to reduce tension on the wound, lowering the risk of reopening during recovery. From a psychological perspective, the hidden scar helps new mothers feel more confident after surgery. This incision, therefore, forms the foundation of the best cesarean section technique, as it combines surgical practicality with patient satisfaction. The Misgav Ladach method, developed in the early 1990s, revolutionized cesarean section practices. Unlike older techniques, it emphasizes minimal tissue handling, blunt dissection instead of sharp cutting, and fewer sutures. Instead of cutting through multiple abdominal layers, surgeons use their fingers to separate tissues, reducing trauma and bleeding. The uterus is usually closed in a single layer, and the peritoneum, the protective lining of the abdomen, is often left unsutured. Research shows that this significantly reduces operative time, blood loss, and postoperative pain. Women who undergo the Misgav Ladach method typically require less analgesia, recover faster, and are able to resume normal activity sooner. From a surgical perspective, the technique is efficient, often shortening operation time by 10 to 15 minutes compared to traditional methods. It also results in fewer adhesions, which are internal scar tissues that may cause complications in future pregnancies. Overall, this method represents a shift toward gentler, patient-centered surgical practices. The combination of the Pfannenstiel incision and the Misgav Ladach technique provides multiple advantages for both mother and baby. For mothers, the reduced trauma leads to faster wound healing, less postoperative discomfort, and earlier mobilization, which lowers the risk of blood clots. The shorter hospital stay is not only cost-effective but also beneficial for maternal mental health, as women can return home to bond with their newborn sooner. Babies delivered via this method often experience a smoother transition, as the surgery is performed quickly and efficiently, minimizing fetal distress. Additionally, because the technique reduces infection risks, both mother and baby enjoy safer outcomes. Studies have also found lower long-term complication rates, such as adhesions, which can affect future pregnancies. In short, this surgical approach ensures that cesarean delivery is not just a life-saving procedure, but also one that prioritizes long-term health and well-being for both generations. In conclusion, while cesarean sections will always carry certain risks, advancements in surgical techniques have greatly improved maternal and neonatal outcomes. The Pfannenstiel incision combined with the Misgav Ladach technique is widely regarded as the best cesarean section method due to its efficiency, reduced trauma, and excellent cosmetic results. By minimizing operative time, blood loss, and pain while promoting faster recovery, it has transformed the way obstetricians approach surgical childbirth. For women, this means safer deliveries, quicker recoveries, and a greater sense of confidence and comfort during the postpartum period. For healthcare providers, it ensures consistency, safety, and efficiency in one of the most commonly performed surgical procedures. As medical technology and techniques continue to evolve, this approach remains a shining example of how modern surgery can balance effectiveness with compassion. Ultimately, the best cesarean section technique is not just about delivering a baby. It is about ensuring the best possible beginning for both mother and child.